Konnichiwa, Dr. Braces here. Thank you so much for tuning in. We're so excited to have you. It's a fun topic today. We're going to talk about wisdom teeth. I was a dentist before I was an orthodontist. I practiced for 4 years in the Air Force, and I loved taking out wisdom teeth. I probably did about 200 wisdom teeth cases while I was in the Air Force. I love taking out wisdom teeth. I can't do it anymore because once you claim orthodontic specialty, you have to stay within your specialty. So even though I love taking out wisdom teeth, can't do it anymore because I'm now an orthodontist. But I have some knowledge on this topic. I hear this a lot from patients that come in that have had relapse, meaning we've straightened their teeth are no longer straight, and they tell me it's because my wisdom teeth came in. When my wisdom teeth came in, they made all my teeth go crooked again. Is that fact or is it fiction? That's actually fiction, believe it or not. We thought that was the case simply because a lot of the times the teeth go crooked again if we're not wearing our retainers. And so for a long time, we thought the wisdom teeth was causing that issue. The reality is, cannot generate enough force to make every single tooth in front of it move and shift. So the wisdom teeth won't actually cause shifting of straight teeth. What it will do is it can get stuck. Bacteria can get around that tooth once it's stuck. It can cause abscess. It can cause infection. It can cause bone damage. It can cause other problems, cavities on the teeth in front of it. And I'll show you some examples of some cases a little bit later on. But it won't actually cause the straight teeth to go crooked again. What does cause that? It's actually what we call residual bone growth. Basically, as we age, our bone is always changing. The bone is remodeling, and as bone is changing, teeth can move and teeth can shift. And so as long as you wear your retainers, the teeth won't move and everything will stay straight. That's going to be true regardless of if you get your wisdom teeth out or if you keep them. So the main component if you want to keep your teeth straight is making sure that you're wearing your retainers. If you get your wisdom teeth out and you don't wear your retainers, the teeth are going to go crooked again. If you keep your wisdom teeth and you don't wear your retainers, the teeth are going to go crooked again. So it's two things that we used to think were linked, but now we know and understand that they're actually unrelated. So the more important part than getting your wisdom teeth out for the sake of keeping the teeth straight is wearing your retainers. Now there's many other beneficial reasons to get your wisdom teeth out. I like to send my patients over to the oral surgeons around age 15 to 17. And again, we'll show you a case of this, but the main reason is if those teeth are stuck under the bone and there's not enough room for them to come up, the tooth is going to continue to grow, and there's a nerve down there that it feeds all of your bottom teeth, and then it pops out like right here and then feeds your chin. And so if that nerve starts to interact with or compress on the wisdom tooth, when the wisdom teeth come out, it can actually damage that nerve and you can get some permanent numbing here. And so again, when we're young, we have more of a vascularity, more blood supply. When we take those wisdom teeth out, guess what? The tooth hasn't fully formed yet, so it's a smaller hole, which means faster healing. So I have 4 cases to show you. We'll go over those really quick. Either was born without this wisdom tooth or they didn't, or they already had it taken out. Now what you can see here is what we call a horizontal impaction. That means the tooth is laying down sideways, and it's obviously not going to come in. So this is one you definitely want to get out. The main reason is, and I saw this in a case of mine in the Air Force, that this patient had chose not to have the wisdom tooth taken out. Basically, cavities are going to form where teeth touch. And in a case like this, where this one's partially breaking through the skin here, bacteria can get under there. You can't clean it, you can't get it out. And so the cavity will form right here where the teeth touch. And what will happen is no dentist can go in and restore or repair a cavity here, right? It's too far down on the root, it's under the bone. So my case in the Air Force that had the cavity develop here, basically we had to extract the wisdom tooth, the upper wisdom tooth, and this one as well, because again, that was a non-restorable tooth at that point, where had he got the wisdom tooth out more proactively, that never would have been a problem for this tooth here. And actually in that case, it was the same thing on the other side. He had a cavity on this root here. So not only did we take the wisdom teeth, but we took the 2 second molars as well. Now, one more point that I wanted to make on this case is because he had this wisdom tooth taken out, but left this one here, teeth want to touch something when we bite. So see how these teeth are coming in contact when we bite down? If this one doesn't have anything to hit, guess what? It's going to what we call hyper-erupt. It's going to keep coming and coming and coming and coming and coming all the way until it hits the bone down here, right? So eventually he'll have to get that tooth extracted or at least have a retainer that includes that tooth to prevent it from hyper-erupting or moving down. So that's one reason why when we take bottom wisdom teeth out, we almost always will do the top as well, just because they're going to continue to erupt when they don't have anything to touch or hit. Is 3D, right? We have the horizontal impaction here, the potential for a bacterial infection to come down and cause a cavity in the root here or an abscess here. And then the upper wisdom tooth won't have anything to hit once this one comes out, so you want to take that one out. And that's certainly going to be the case over here. This tooth eventually is going to move down, 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 all the way until it starts to hit this ramus of the bone right here. So that's why, again, when they do the other two on the other side, they'll probably take this one as well. Where we are at a perfect time, maybe even just a little bit late as far as getting the wisdom teeth out. So you can see wisdom teeth growing in sideways, not enough room for them. So we need to get those taken out. Upper teeth will come with them. Now what's happened is these are not full horizontal, partial horizontal impaction, meaning they're stuck. They're probably poking through here like we talked about before. Bacteria can get down in here, cause an abscess, cause cavities on the roots of the tooth in front of it. So that's the main reason. Now the reason why this is a good time, this dark line that you see right here, that is the nerve that feeds all of these teeth. It pops out right here and feeds the chin. So as this wisdom tooth continues to form and continues to develop, it can impinge upon that nerve so that when the surgeon goes in to take those wisdom teeth out, that nerve can get damaged, cause some permanent numbing up in the chin and on these teeth. So that's something you want to avoid, which is why ages 15 to 17 is kind of the best time to do it. Number one, the tooth isn't fully formed yet. Impinging on that nerve as much as it would if that was a full-size tooth. Number two, when they go in to take that tooth out, the hole's going to be smaller, which means it's going to heal faster, right? So again, these are the things that we're looking at. Where's the tooth in relation to the nerve? How developed are the roots? Those kind of things. Now, again, you want to take these wisdom teeth out. You'll do the top as well, even though they're straight up and down, because version of that same patient, right? So we've got the skeleton here. You can see that wisdom teeth on the bottom are impacted. They're stuck. They cannot come in any further. Starting to communicate with that nerve a little bit more. We don't want that. So now's the time to get these babies out. Okay, so now this is a good example of a patient that's going to need their wisdom teeth out, but it's a little bit too early. The main reason being, not really formed roots yet, and so when the surgeon goes in, if they try to take these out, they can probably get them out. It's just very challenging because these wisdom teeth, they tend to spin when you try to elevate them out, and so they're hard to remove. We like to see just a little bit more root structure on the teeth, so probably a little bit early in a case like this, but definitely you can see how they're coming in. They're not coming in straight up and down like the first case I showed you. They're growing in a little bit sideways, which means there's not enough room. They're probably going to get impacted or stuck, and so better to take these ones out at a young age, but still probably too early. I would wait about 2 or 3 more years before we started thinking about taking these ones out. Let's look at the skeleton, because that's always fun. So same patient, and like I said, you can see wisdom tooths coming in sideways in that direction, right? Bottom one is also coming in sideways. So this is a patient that more than likely we will recommend to get the wisdom teeth out, but not for a couple more years. So this is a case that I actually saw this morning. Transfer patient, she's already got braces, but what you're looking at here is 6-year-old molar, 12-year-old molar, wisdom teeth. Notice how the wisdom teeth came in. There was enough space for them. They're in the bite. So everything's actually lined up pretty well for this patient to be able to keep their wisdom teeth. So this is a case where I would not actually send to an oral surgeon, and that if any of these teeth ever get cavities, they're very hard to fill because you can't get the handpiece back there at the right angle. And so a lot of the times the dentist will recommend extraction if these teeth get cavities over fillings. Not all the time, it depends how wide you can open. But this is a perfect example of a case that does not need, same patient here, just the skeleton version, patient that does not need these wisdom teeth out because, again, plenty of room for them. They came in and aligned in the proper position, not going to cause any kind of problems like infections or pain. Once you hit a certain age, it becomes less beneficial to take that wisdom tooth out because it may the chances of the surgery being harder recovery, it outweighs the benefits of actually taking the tooth out at that point. My sweet spot, 15 to 17 is ideal. 18 to 25 is still fine. Now, It used to be if you had an impacted wisdom teeth, you'd go see the oral surgeon. They would always recommend that you take it out. So majority of the time, if you're over, let's say just over 40, for example, oral surgeons out there, correct me on that number, but let's just say you're over 40, you have an impacted wisdom tooth, it's asymptomatic, and it's partially poking through the gums, it's buried under the gums, more than likely a surgeon's going to recommend that you keep that tooth at that point. And if it starts to cause you problems, you can always take it out. If you have braces, if you have Invisalign and the wisdom teeth start to bother you, can you get the wisdom teeth out with braces? Absolutely you can, especially if they're bothering you. If they're not bothering you, I usually just say wait till the braces are off. That's simply because the surgeons, they're going to put you to sleep in most cases. They're going to prop you open with something called a bite block. That bite block is exactly what they need to get those wisdom teeth out, but it can break your braces off. So if, again, the wisdom teeth aren't symptomatic, they're not causing you issues, usually we just say, let's wait till the braces come off, 6, 8, 12 months or whatever, and then we'll get the wisdom teeth out then. But if they're symptomatic, causing pain, absolutely I'm going to send you to the surgeon at that point. Okay, so I hope this video was helpful, especially if you're at that point where you're thinking it may be time to get your wisdom teeth out. Definitely ask your orthodontist the next time they adjust your retainers, or your dentist, and they can get you into the right hands to an oral surgeon to get those wisdom teeth out for you. If you have any questions or comments, feel free to leave them in the comment section, and we'll be sure to get back with you. Thank you so much for tuning in. Don't forget to like and subscribe. And our next video, we are going to show you a case of what can go bad with a tongue ring. This is actually like a really cool video, really cool case. So I would encourage you to take a look and see what can happen when a tongue ring goes bad. Most of the time, tongue rings aren't going to cause patients any problems, but if you have something called a tongue thrust, that can be problematic. So click on that next video. Like I said, I think you'll enjoy that one as well. Remember, smiles change lives, so keep smiling.